automated pipeline for hydrocephalus diagnosis within medical image repositories, an artificial intelligence approach. The current work uses clinical images of children diagnosed with hydrocephalus and runs artificial intelligence to estimate the volume of ventricles. The clinical necessity comes from the difficulty to estimate volume from medical images. This 11 seconds video shows a patient before and after in a shunt procedure. If you pay attention, you will be able to see the draining device in the right-sided brain. These images were acquired with different setups, including different spatial resolution. From here, the complication is to know if the shunt is working. In the clinics, estimating the volume of the ventricles is solved by performing manual segmentation. These may take between 12 to 15 minutes to an expert, provided that the institutional review board has authorized the use of the images out the clinical pipeline. Manual segmentation is always tedious and operator dependent. The 29 seconds video shows a manual segmentation performed using a homemade tool developed to facilitate the work to the expert. Here we have the main volume estimation obstacles. Clinical imaging has non-uniform protocols. Medical images reside in a protected database. PACS system has limited interactivity. Manual segmentation of structures is operator dependent. So, we postulate our research question. Is it possible to obtain accurate brain ventricular volumes automatically from CT/MRI studies? In this work, we propose an alternative to registration-based solutions. Here, we see the separation of the ventricles as a classification problem. In the learning stage, we use 4 features in manually segmented mass as a supervising factor to create statistical estimator. When willing to obtain the ventricular mass in a new subject, the 4 features used in the training stage are extracted from the new image and feed to the statistical estimator. The voxel-based classification should return a mass that separates the ventricles from the original image. The features used are the normalized distances, where each voxel is assigned the distance from the scanner central voxel to the voxel position. The histogram-based label. Here, each voxel is assigned a number from 0 to 3. The background is 0. 1 is CSF. 2 is gray matter. And 3 is white matter. The regions are defined by detecting the most significant changes in the envelope of the histogram extracted from the image. The neighboring. Each voxel is assigned a value depending on how similar in intensity are their neighbors in a 3D neighborhood. The cardinality. It is just a consecutive numbering that dissolves ambiguities in the radial distance of the ND feature. Here, some volumetric examples where we have overlapped the manual segmentation, Zion, and the automatic ventricular volume estimation, AVVE, results. Note how the subject with the cis subject D is still a challenge to the AVVE. In mild, moderate, and severe cases of HC, we obtain up to 94% of similarities when comparing with manual assessments. With the ABBE, it was possible to resolve the problem proposed at the beginning of this presentation. After the shunting, the patient has experienced a reduction in the ventricular size of 41.4 milliliters. Segmentation is converted in a classification problem. Volume estimation is fully automatic. Volume estimation is reproducible in contrast to human variability in manual segmentation. The AVVE is PACS compatible. If you have any questions, please send them to fernando.yepes@strategicvp.net. Thanks.